Hi everyone, welcome back to the channel. I'm Dr. Lucy Coleman, a specialist in reproductive medicine and fertility. Today we are answering one of the most searched questions online. What you really need to know before freezing your eggs. Egg freezing is becoming more common as women delay pregnancy for personal or professional reasons. But there is a lot more to understand than just the idea itself. Let's break it all down. First, what is egg freezing? Egg freezing, or oocyte cryopreservation, is a process where your eggs are collected, frozen, and stored so they can be used later for pregnancy through IVF. It literally pauses the biological clock for your eggs at the age you freeze them. This is different from freezing embryos. With egg freezing, you are preserving your eggs alone. You will decide later with your partner or donor sperm which eggs to fertilize when you're ready. Women choose egg freezing for many reasons. They want to delay pregnancy for career or personal goals. They don't have a partner yet but want options. They face medical treatments that threaten fertility. They want reproductive insurance for the future. Because egg quality and quantity naturally decline with age, freezing earlier can preserve healthier eggs. One of the biggest questions: what's the ideal age to freeze your eggs? Egg quality and quantity decline gradually in your late 20s, then more steadily after 35. Most specialists consider freezing in your late 20s to early 30s because that's when your ovarian reserve is generally stronger, giving you more and better quality eggs to store. That doesn't mean it's too late after 35, but the success rates are higher when freezing is done earlier. Another key question is, how many eggs should you freeze? There is no one number that guarantees a baby, but more eggs generally increases your chances. Experts often recommend 10 to 15 eggs if under 35, 15 to 20 if you're older. The exact number depends on your age, goals, and ovarian reserve. Your fertility doctor will help tailor this for you. Now let's talk about what actually happens. The process includes consultation and tests, hormone levels, ovarian reserve, and health screening. Also an ovarian stimulation with daily hormone injections for 10 to 14 days to grow multiple follicles. The monitoring with ultrasound and blood tests to track progress. Then the egg retrieval, which is a brief outpatient procedure under sedation to collect the mature eggs. And then the freezing, which is the vitrification, where the eggs are rapidly frozen to preserve them. Most women are surprised how quick and controlled the process is, and that the retrieval itself is typically done with little discomfort. People also ask, what are success rates with frozen eggs? Success depends on age at freezing and how many eggs you preserved. Early studies show good outcomes. For example, younger women who freeze 10 to 20 eggs may have a solid chance or at least one live birth when they use them later. It's important to remember every egg doesn't guarantee a baby. Not all eggs survive thawing, not all will fertilize, and not all embryos implant. But freezing boosts your future options significantly. Before you decide, you should also know risks and side effects. Hormonal meds can cause bloating, mood changes, mild discomfort, rare risks like ovarian hyperstimulation, which are possible. Also the costs. Cycles vary widely in price, and storage has ongoing fees. Then the storage and the planning. You will decide what happens to unused eggs, keep storing them, donate them, or discard them. Insurance may cover parts of fertility testing or egg freezing in some locations, so check policies early. Here is what many people also ask in Google and what I advise. Ask your doctor your personal success odds based on age and reserve. Understand how many cycles you might need. Sometimes one is not enough. Ask about clinic success rates and lab expertise because this matters. Egg freezing isn't simple, but with the right information and support, it can be empowering. If this video helped clarify egg freezing for you, please like, subscribe, and share with someone who might benefit. And leave your question in the comments. I read them and often make new videos based on what you want to learn. Thanks for watching.